Welcome to the ED Clinics podcast. My name is James Woolidge and I'll be your host for this series where we'll be discussing everything to do with shockwave therapy and men's health conditions. That's everything from erectile dysfunction through to chronic pelvic pain syndrome, Peyronie's disease, hard flaccid syndrome, amongst others. We'll be talking to a host of experts from around the world to shed some light on these complex conditions. And we'll also be talking to patients that have been through treatment journeys themselves, so you can get a greater understanding of how we can help a broad range of people with these conditions. So, without further ado, enjoy this episode. Okay, so thanks for joining us. This is our podcast for ED Clinics, and we're joined today by Kevin, who is going to talk us through his experiences with chronic pelvic pain syndrome. And the clinician that treats him is Yves De Vos. He's well known in the world of ED Clinics. He's one of the directors of ED Clinics. And just on that note, Yves, you've got two clinics down in the south of England. Could you just let us know where they are? Where do you work from?
Yeah, so I've basically got a clinic based in Waterlooville, which is Hampshire, so it's just north of Portsmouth, and then the other clinic is in Woodley, which is near Reading, so Berkshire. Yeah.
Okay, fine. So Kevin, thank you very much for joining us today, because we're trying to get patient perspectives on and all sorts of things to do with men's health. Yeah. And it's really good of you and slightly brave to share your insight on this topic, because many men don't talk about these things, and you've kindly suggested that you will. So for everyone out there, chronic pelvic pain syndrome used to be prostatitis or non-bacterial prostatitis, and the overarching term now, CPPS. So, but there are a number of differences as to how people experience that condition. Could you just give us a talk through about how your symptoms were when things started?
Well, mine has quite a long history and then a more recent, much worse history. So, I mean, for me, when it very first started, I was actually a teenager.
Right.
Bear in mind,
how old are you now, Kevin?
43.
Oh dear. Okay.
But it wasn't chronic. It was very off and on. It may only affect me a couple of times a year. It would last like a few hours. It would go away. I kind of got used to that's how life was.
Yeah.
I didn't really find out about even the word prostatitis until I was about 35, 36 through my own research. I was put on some tablets called tamsulosin, which helped with a lot of the urinary symptoms. Mm-hmm. when it and then stopped it from coming on so much or so severely. In terms of if it did come on, it went away sooner. But my reason for seeing Yves was because in May 2022, last year, it went chronic and would not go away, and I was stuck in a lot of pain that was seriously damaging every part of my life. I mean, I can go through the symptoms if you want, but you probably
know. So where did you feel most of your pain coming from? The
symptoms I had always, when I was younger, the symptoms I always had that came on was a kind of like a fiery acid feeling going from what feels like your bladder, where you think your prostate probably is, running all the way through the urethra to the tip of the penis. That was what would usually happen. When it went chronic, I had all that plus further problems in that it felt a lot of pain, as if I'd been kicked in the groin, basically. And that just wouldn't go away. There was pain in the head of the penis. There was pain in the testicles. There was pain within the anus and the lower back, and became more of what you'd call an overall chronic pelvic pain. Went to doctors numerous times. Obviously, they don't really know what's going on. They do all the tests, do lots of STD tests, all clear. Month after month, clear every single time. And I said it would be. I said, I've had these tests all my life. I said to them, and they said, we've got to do it anyway. It always came up with nothing. Apart from they just sort of said, you have a chronic form of prostatitis. I have had a scan, and back last September, can't believe it's almost a year ago now, and the prostate was very red. But in terms of a lot of what I've worked with Yves and through my own research, I've found that a lot of it could have been actually problems with the pelvic floor muscles that have actually caused the urine to actually be reflux and spasm back upwards, which is then causing the prostate problem. So it seems like there's this sort of, they seem to think it sort of starts in the prostate, and by they I mean like the medical industry in terms of doctors, but it would seem that the prostate might be more of a casualty of the original problem,
I like that.
rather than the start of the problem.
Right. Okay. So you'd run the whole gamut of urology, I guess. You'd gone to that level where they did the scan.
Yeah.
It sounded a little bit dismayed by their approach.
Senior urologists, and I mean, the NHS don't seem to have time to be able to help, and I find private urology, unless they're gonna, it sounds bad, but unless they're gonna make some money out of some sort of operation to give you, they're not interested. And once they've diagnosed you with what they would say prostatitis, or whether chronic pelvic pain, whatever they want to call it, they know there's nothing that they can surgically do or tablets that are going to help long term. I mean, I would say antibiotics have still bizarrely helped, which is where I find with a lot of people they don't. I've never been diagnosed with any sort of no disease or anything, but apparently sometimes the antibiotics can have an inflammatory effect, an anti-inflammatory effect.
Anti-inflammatory, yeah, that's right.
And it's possible that anti-inflammatory effect was what was temporarily helping me, because as soon as I came off those antibiotics, give it a week, and I was getting back to square one again. So yeah, right. So I've been through quite a year of hell.
So what led you to that point where you discovered? How did you discover Yves and ED clinics and how we might help? Because as you know, there is lots out. The more you read on this topic, there are lots of things you can do to treat this. So what brought you to ED clinics and him?
I tried treating everything else, I think.
Oh, right, okay.
I've tried, they sort of say try, things like saw palmetto or other things like that. So I've tried antibiotics. I was doing a lot of sort of stretching and yoga stuff, which was kind of helping, and hot baths, but it was more like a plaster on the wound. It wasn't sort of really helping. I suppose I was looking for a cure and kept being told there isn't one. But I found the ED clinics, just online, Google, I suppose, just lots of research.
Yeah.
And I looked up a video that was about chronic pelvic pain on ED clinics. And there was a guy on there, and he was basically sort of saying that he's sort of 90% better. And I thought, well, this is worth looking into. So I went from there, really. So I phoned up Yves, and we had an initial consultation meeting, and it was the first time I actually heard.
Oh, that's nice.
Rather than just being told to put up and shut up, basically. It seemed like Yves was at least willing to try and give it a go. Let's see if this will help. So I was booked in for an initial sort of 6 sessions, and despite some setbacks, and the setbacks were because anything triggered me, just anything really. But I had already made massive life changes, like giving up alcohol, caffeine, things like that, doing the yoga stretches all the time. And those things I think were helping, but the slightest little thing, like a bit of a slight spicy food, was just set it all off again. Or just stretching or moving in the wrong way all of a sudden, down all of a sudden. The symptoms were always there, but that could make it even worse. So those 6 sessions were very useful. First of all, we then gave it a month off to wait and see how things went.
Yeah,
things were still sort of improving over that month off. And then I went back for another 6 sessions. And the last time you guys saw me or spoke to me, I think, was probably middle of May.
Okay.
And I'd like to say I've still been improving since then.
Brilliant.
Okay. That's great. Yeah. That's really great, considering how long you've had it. That's pretty good change since you went from episodic as a teenager to chronic.
Yeah.
And with those changes that you've made, that's really good to hear.
Yeah.
Yves, can you just summarize a little bit about what the approach that you've been taking for those sessions?
I mean, obviously partly we were using shockwave, but we all know about the sort of importance of putting everything together, and Kevin was really, really good at, he'd obviously done a lot of research himself. he was really dedicated to making this work. So he did everything he possibly could.
Yeah.
And I think that that's been partly the success of this as well, is this combination of, the diet, not making sure that there's no irritants, then obviously doing some deep breathing type exercises to try and relax the pelvic floor, some sort of more bigger stretches for the sort of big, hamstrings, quads, hip flexors, all of those kind of muscles attaching to the pelvis to try and release those. He did a lot of sort of self massage, self trigger pointing, all of that, which, and then what I did was a combination of, shockwave therapy, but I also actually used EMTT as a combination treatment.
Yeah.
So treating the penis, the perineum, but also the sacral area. So trying to really reduce any kind of tension, inflammatory component around the whole of that pelvis.
Okay.
So we did them on a sort of weekly basis. We did a session per week. And then obviously we had that. I wanted to sort of give Kevin an opportunity to evaluate the effectiveness of what we done to start with. Yeah. And obviously in that evaluation period, he continued with all the sort of self-help methods in between. But what was nice was that obviously that we actually saw a change. So at least we knew that Kevin was responding to the treatment.
Yeah.
That's really where we decided to then take it that little bit further. And there was a distinct difference between the first group of sessions and the second group, because the first group, we were just literally up and down like a yo-yo. It was, the tissue was so irritable that, the slightest bit of change would just trigger the whole thing off. By the time we actually did the second course, things were more stable. Things were already a little bit more controlled. And then, the progress in that second course of treatment was quite phenomenal.
That's really good. And so what was your experience? Because a lot of men will say, I mean, in terms of your symptomatology, have you improved to the point where you've gone back to a point where you have days free of pain now? Or is it just the total level of pain has reduced, i.e. you've still got daily pain, but the pain is reduced? Do you see what I mean?
I'm at a point right now where I'm not in typical pain.
Right.
If I sit too long on, say, a hard seat, some of the pain will come back. But I have a standing desk at work now. That's another change I've made, which has really helped. Or if I'm sort of sat in a driving seat too long, then I can start to feel some of the pain in the perineum, that sort of pressure pain pushing up.
Yeah.
But it only starts to come back slightly and gradually. All the urinary symptoms, everything else is gone.
Wow.
Everything else is functioning normally. I'd say I'm sort of 95% recovered, maybe more. And I didn't mention, but I've always been keen going to the gym, lifting weights, and for the best part of a year that had to stop, and it was horrible just sort of seeing myself literally waste away.
Yeah.
For the past 6 weeks, I've been back regular at the gym.
Fantastic.
Not over pushing it, but I've been putting healthy weights back on. And yes, and it's not only just sort of walking around and being able to bend over and do things properly like that again, but actually be a reasonably healthy person and actually go back to a gym. Yeah.
And I think that's quite important again, is that, once the symptoms are more controlled, is that obviously normal activity can be resumed, but we very much use the sort of graded exposure principle of just gradually, increasing the activity, increasing the load, just to make sure that there was not, a sudden increase in tension through the pelvic floor, which could then trigger the symptoms again.
Yeah. So you said to me to go very careful, and that's what I did.
Yeah. And so I think on that note about the fact that why I was asking is that quite a lot of patients like yourself, that because of where the pain is and how it affects so much of you, it becomes all consuming, that it's every minute and every hour of every day where you're thinking and considering it. Yeah. So have you now got sort of mental respite from that now being so much better as well.
Yes, yes. The mental torture is just as bad as the physical.
Yeah, that's what everyone.
I mean, it was kind of bad and scary when growing up when it would be triggered. But I got used to it going away after a few hours. But of May last year, 2022, you know, when it didn't go away after a week, 2 weeks, and it goes into months, no one's given a damn, and there seems to be no answers, you start to get scared. And then the only answers you do find on the internet is, you know, oh, this is chronic pelvic pain. People have lived for a decade like this. This is just how it is. Got to learn to live with it. And I just sort of thought, no, I'm not living with it just like this. There must be something that can at least you know, dull it down so that it's bearable.
Yeah.
But yeah, it starts. I mean, I think it would be the same of any chronic pain. But it's also not the chronic pain. It's also the embarrassment of, you know, you constantly needing, like, you feel like you need to go to the bathroom. And sometimes you do, sometimes you don't. So there's an embarrassment to it that can come through as well, and it's that shame factor, and shame can affect people very, very badly.
Yeah. So if you were to, you know, this sounds like I'm leading you in a particular direction. I'm not actually, you know, because when we see patients, you know, we have sort of, you know, clinical responsibility about saying, look, you need to go see your GP, you need to get a urology checkup and so forth. Given everything you've learned over time and how many times you went repeat back to NHS, whatever else, at what point would you, you know, in your journey, when you reflect, would you say to, you know, in terms of advising other men with this condition, at what point would you say, look, actually, is at this point here, it's worth searching out this as an option?
Okay, I would say it's still best to you know, get things like the STD checks done as a matter of course anyway, just in case. And I mean, I had a full scan to make sure that it was nothing cancerous.
Yeah.
So make sure you get that cleared out of the way as well. But I think once both those things are cleared, I think, you know, go to the ED clinic and research if that, you know, have a consultation and research if that is the right way forwards.
Yeah.
Especially if you've been diagnosed. Yeah, I mean, I suppose you need to be diagnosed with prostatitis as well, really. So that you at least know what you're dealing with. But to be honest, with all the information on the internet, I know you shouldn't self-diagnose on the internet now, but if it's ticking all the boxes of all the symptoms of what I just said, then that's pretty much probably what it is.
Yeah.
And you need treatment. And I mean, I don't know why the shockwave treatment works. I mean, no one seems to know exactly why, do they? But I mean, it was like I was caught in a pain cycle.
Yeah.
And it just couldn't get out of it. And whatever this did, it kind of broke that pain cycle.
Yeah.
And allowed my body to start healing.
I think I've known Yves for quite a while, and I think Yves will agree with me on this, that if anyone in the world of medicine and human bodies say they know exactly why something works, you should probably go see somebody else.
Right. Yeah.
100% foolproof. Shockwave does this. No.
Yeah.
But what we do know at the moment, rather like you eloquently, I have to say, I mean, I'm interested. Well, I shouldn't ask what you do for a living. It's not my business. But the way you discuss this is pretty impressive. But I mean, the point you get to, which is that point where it doesn't take a lot of research to find out that your options are really minimal in terms of, you know, once you've gone through the sort of normal stuff, and antibiotics don't do anything major and, you know, great, and then you're into sore tomato and other things, there isn't much out there that's left, which is why, you know, an anti-inflammatory and a few other mechanisms we think how it works, shockwave is a good non-invasive approach, because everything else is potentially quite invasive. So that's why I think it sits in that nice middle ground, whereas, yes, of course, it costs something to do, but it's not going to cause you any harm by trying it. And it's probably got more evidence to it than, well, sore palmetto and a few other things. But yes, there is a
problem. As you just hit on a point there where it says about how it's not going to try any harm in doing it. That was one of the things that was also advertised on the website, and I you know, I looked up some research as well. I think there was like some YouTube clips as well, and it seemed like, yeah, what have I what have I got to lose? Really, it's worth the money, and it's worth trying. And if it doesn't work, it doesn't sound like I'm going to be any worse off. So might as well try it.
That's great. Yves, have you got anything else to say on the subject?
I think for me, we get, the reason why we do this job is because we see changes in people, and not so much always the sort of physical changes. As a physio, it's great that, if somebody comes in with a pair of crutches and then 6 months later they do sprints, which is great. But I think it's this, when you're looking more at complex patients, when you're talking, we're talking about people's mental health and how it affects, their whole life. Now, I personally have seen a huge transformation in Kevin from when we first, met each other to, where he is now. He's a completely different person, I hope you agree with that, but he was completely encompassed by this problem. Yeah, it was the only thing he could think of because it was affecting him so much. As we got to know each other and we worked together, and the condition got better, we even our sort of consultations weren't always completely focused on the condition. We actually started to talk about camping and cycling and all of those kind of things, which was really nice to see that. Obviously we could see that transition and getting that confidence back and belief that there's that things could get better. And I think that for me is the biggest reward, to be honest.
Yeah, good. Kevin, unless you've got anything else to add, I'd just like to say thank you again for joining us. It's very brave of you, really good. And the way you described it was absolutely brilliant. So thank you for that.
Well, no, I hope my input helps other people, really. Because this is exactly the sort of information when I was ill that I was looking for.
Yeah.
So I hope this helps other people.
Good for you.
And keep going with the shockwave treatment. It's a shame it's just not more sort of known across the country.
We're working on that.
Yeah, I hope so.
Well, none of us will say it's 100% foolproof, and we don't quite know 100%.
No.
But it works really well for lots of people, and that's what counts, right? So thank you very much, guys, for joining me tonight, and good luck for the future, Kevin. Hope it all carries on being good for you. Cheers.
Thanks, Kevin.
All the best, guys. Thank you.
Okay.